My name is Kathy Harrell, and I am the coordinator of the Surrogate Parent Program at Parent Information Center. This training is being presented for those interested in becoming a surrogate parent for a child in the foster care system and who is receiving or may receive birth to 3 early intervention services. Interested individuals will learn about Delaware's Birth to 3 Early Intervention Regional Program so that they can participate effectively with a team once they are appointed as a surrogate parent. This training will cover information about the Birth to 3 program, also referred to as B23. It will include the referral and evaluation process together with the IFSP, or Individualized Family Service Plan. The mission of Delaware's Birth to 3, or B23 Early Intervention Regional Program, is to enhance the development of infants and toddlers with developmental delays and disabilities, and to enhance the capacity of their families, surrogate parents, and caregivers to meet their special needs. The guiding belief for the Division of Family Services, or DFS, and B23, Birth to 3, interagency relationship, is for children who have been referred to B23 for disabilities or for suspected developmental delays and who have an active case with DFS to have a go-between in the form of the DFS liaisons and the B23 Family Service Coordinators, or FSC. The DFS liaisons and B23 Family Service Coordinators can act on behalf of the children and work with them, their families, and foster parents to meet and to address their exceptional needs in a shared partnership. This training is especially geared toward foster parents who want to be their foster child's surrogate parent. Once appointed as the child's surrogate parent, you will assume rights and the responsibility for participating with a team in making decisions about having the child evaluated and what services the child may be eligible for to meet their special needs. The B23 journey begins with a referral. Let's take the steps to start the B23 journey. A foster parent may be aware that their foster child has been given a medical diagnosis of neonatal abstinence syndrome or neonatal opioid withdrawal syndrome or prenatal drug exposure. A foster parent or healthcare provider may have concerns about the child's development. Concerns may be that the child's muscles seem stiff or floppy, the child struggles to roll over, sit, or walk, the child has difficulty holding their head and neck steady. Other developmental concerns may be that the child does not move their body like other children their age, has difficulty doing a skill that other same-age children can do, or the child can no longer do a skill they used to do, or the child may have an unusual gait when walking. For a child in foster care, the DFS worker will make a referral to the B23 program, providing information to start the B23 journey. The DFS liaison and the B23 Family Service Coordinators will help to facilitate this process. To begin with, the FSC Family Service Coordinator will contact the foster parent, will explain the B23 program, and the FSC may also ask if the foster parent is interested in becoming the child's surrogate parent. As a foster parent, it is suggested that you follow up with your DFS worker to discuss becoming the child's surrogate parent. An appointed surrogate parent will assume rights that will allow them to advocate for the child while working with the B23 team. A surrogate parent is included in all decisions about the child's evaluation and possible services with the B23 program. Since you as the foster parent are familiar with the child An evaluation with the B23 program may result in services in your home or with your family. Being appointed as the surrogate parent allows you to make decisions with the team about those services and how and where those services are delivered. If you are interested in becoming a surrogate parent, training information will be emailed to you from Parent Information Center. Training will include an orientation video that provides an overview of the surrogate parent program and your role. If you are viewing this information about B23 now, you are one step ahead, as this is also part of the training. You will be asked to complete several knowledge questions at the end as part of the training. The surrogate parent program will collect and confirm information about the child and the status with B23. Once you have completed this training, the surrogate parent program will make a recommendation to the Department of Education that you be appointed as the child's surrogate parent. The Department of Education is responsible for approving your appointment and sending out your appointment letter with copies to appropriate service providers or involved agencies. A foster parent will be appointed as the child's surrogate parent once they complete training with the Parent Information Center and the necessary documentation has been approved by the Department of Education. And again, you will receive your appointment letter from the Department of Education. Once you have been appointed as the child's surrogate parent, the FSC, or Family Service Coordinator with B23, will contact you explaining the next step, which will be having you provide written consent to B23 for assessment and evaluation purposes. Your assigned Family Service Coordinator, or FSC, will call you once you become the surrogate parent to schedule the Multidisciplinary Evaluation, or MDE, Multidisciplinary Assessment, MDA, the Voluntary Family Directed Assessment, FDA, and the initial IFSP, or Individualized Family Service Plan. You as the surrogate parent decide where the MDE, MDA, FDA, and the initial Individualized Family Service Plan, or IFSP, will take place, such as in your home, the child care, a community setting like a library, or the B23 office. When the FSC, or Family Service Coordinator, calls you to schedule the MDE, MDA, FDA, and the initial IFSP, the Family Service Coordinator will let you know how long the Multidisciplinary Evaluation, or MDE, will take. It usually takes about an hour and a half for the multidisciplinary evaluation and the multidisciplinary assessment. The Family Directed Assessment, FDA, and the initial IFSP can also take 1.5 hours each. It all depends on the needs of the child. When preparing for the MDE, or multidisciplinary evaluation at home, please have a variety of age-appropriate toys available that encourage different developmental skills. Some examples of toys to have available are blocks, stacking cups, spoons, bubbles, musical instruments, and picture books. This will allow the evaluator to observe the child's natural interaction with items they are familiar with in their environment. The multidisciplinary evaluation is an evaluation and assessment administered by two subject matter experts. The multidisciplinary evaluation team will evaluate your foster child for developmental delays in 5 domains: cognitive, social emotional, adaptive behavior and self-help, physical, including gross motor and fine motor, communication, including expressive and receptive language. If the evaluation and assessment show a delay of at least 25%, then the child is determined to have a developmental delay and eligible for the B23 program and services. There are exceptions to when the MDE, or multidisciplinary evaluation, is required, so let me mention those. The MDE is not required if the child has what is called a Delaware birth mandate. That is, if the child has autism, is deaf-blind, has a hearing impairment, or a visual impairment, including blindness. Also, if the child has a B23 established condition, an MDE is not required. Examples of established conditions are shaken infant syndrome, traumatic brain injury, prenatal substance exposure, prematurity, and prenatally acquired infectious disease. The multidisciplinary assessment, MDA, is required and is completed by qualified professionals with the FSC and parent or caregiver. The MDA identifies the child's strengths and needs, how those strengths and needs tie to family routines, and the current level of functioning in all 5 domains: cognitive, social emotional, adaptive behavior and self-help, physical, including fine and gross motor, and communication, including expressive and receptive language. The Family-Directed Assessment, or FDA, is a voluntary process that is optional. It is focused on the family as a unit, and it helps families identify their concerns, priorities, and resources related to their child's development and family-specific concerns. The FDA is a one-to-one discussion with a member of the child's team. It allows time for a family to share information about their child, as well as their priorities and concerns. The FDA helps families determine what they need from the Birth to 3 early intervention program and helps to prepare a family for participating in the child's IFSP, or Individualized Family Service Plan, meeting. If your child qualifies for Birth to 3 early intervention services, then at least a 25% delay in an area of development was determined. Once a child qualifies for Birth to 3 early intervention services, a document called the Individualized Family Service Plan is created with your team. The IFSP team, which you are part of, works together to understand your family's routines, values, and priorities, which help create functional outcomes. These outcomes guide us in identifying supports and/or services to meet those needs. The IFSP is reviewed every 6 months, annually, and whenever there are changes, such as a change in services. Once your child's needs are determined and services agreed upon to address those needs, services will begin in the home or in a daycare or a specialized daycare. Services may also be delivered on an outpatient basis, but the goal would be to provide services to a child in their natural environment. In other words, the place where the child spends most of their time. A child learns best in familiar places. When a child exits the B23 program before the age of 3, other services may be available through the school district or Head Start or library playgroups or private daycares or other outpatient services. During a transition conference meeting, a transition plan is completed with a surrogate parent or caregiver when their child is no less than 90 days from their 3rd birthday and no more than 9 months before their 3rd birthday. This conference plan may involve, at the request of the surrogate parent or caregiver, the school district for Part B preschool eligibility determination, or continuing community supports for families who are not eligible for Part B services or wish to exit the program without transitioning to the school district on their child's 3rd birthday. Additional supports may include Head Start, based on enrollment eligibility, stay and play community opportunities, or outpatient services at the age of 3. We hope you learned how important Birth to 3 early intervention services can be for a child and their family. As the child's appointed surrogate parent, we encourage you to continue learning so that you can effectively advocate for your child. Should you have any questions or concerns about this training, please contact Kathy Harrell at the Parent Information of Delaware at 999-7394 or KHEREL@picofdel.org. Should you have specific questions about your child and the B23 process, please contact your DFS worker or your family services coordinator.